Hey everyone, welcome back to Vitality Vortex Channel, your go-to spot for the latest tips and tricks on maintaining your health and wellness. If you're new here, thank you for visiting. And today we're diving deep into a topic that affects millions: benign paroxysmal positional vertigo, or BPPV. If you've ever experienced that dizzying, spinning sensation and want to make sure it never comes back, you're in the right place. In this video, we're uncovering proven strategies to prevent BPPV from recurring, so you can enjoy life without the worry of vertigo. From simple lifestyle changes to the role of vitamin D, we've got everything you need to keep those pesky crystals in check. But before we get started, make sure you hit that like button. If you're excited to learn, share this video with anyone who might find it helpful, and subscribe to our channel for more tips and tricks. And don't forget to smash that notification bell so you never miss out on our latest content. All right, let's get into it and take the first step towards a vertigo-free life. People who have experienced benign paroxysmal positional vertigo, the most common type of positional vertigo, often ask how to prevent it from recurring after they have successfully treated it. BPPV is caused by tiny crystals in the inner ear canals that can cause dizziness when they become dislodged. After treatment, which typically involves repositioning these crystals back to their correct location, patients are understandably eager to avoid a recurrence. Unfortunately, recurrence of BPPV is relatively common. To help those who have suffered from BPPV keep it from coming back, I will provide several tips and answer common questions. Can the Epley maneuver prevent recurrence? The Epley maneuver is a common treatment for the posterior canal variant of BPPV. It involves a series of specific head movements to guide the displaced crystals back to their proper place. While the Epley maneuver is effective for treating BPPV, it cannot be used preventively. Once the crystals are repositioned, they should stay put unless they become dislodged again. However, if vertigo does recur, you can use the Epley maneuver to treat it again. How to do the Epley maneuver? Here is a step-by-step breakdown. Start position. The patient sits upright on an examination table with legs extended. Initial movement. The patient's head is turned 45 degrees toward the affected ear. Lying down. The patient is quickly laid back with their head still turned, allowing gravity to help move the crystals. Head turn. The head is then turned to the opposite side. Body turn. The patient's body is turned to align with the head, and they are slowly brought back up to a sitting position. The procedure is typically repeated several times until symptoms improve. The Semont Manuever. This is another repositioning technique. It is faster than the Epley maneuver, but can be more uncomfortable. Here's how it is performed. Start position. The patient sits on an examination table. First movement. The patient quickly lies down on one side with their head turned 45 degrees up. Rapid movement. The patient is rapidly moved to lie on the opposite side with their head turned 45 degrees down. This maneuver also relies on gravity to move the crystals back to their proper place, preventing recurrence of BPPV. Once BPPV is treated, the focus often shifts to preventing recurrence. Although there is no guaranteed way to prevent BPPV from returning, there are several strategies and lifestyle modifications that can help reduce the likelihood of recurrence. Research shows that recurrence of BPPV is fairly common. Studies suggest that up to 50% of patients may experience another episode within a few years of their initial treatment. The recurrence is thought to occur because the otoconia can become dislodged again, especially in individuals who are predisposed to this condition. Tips to prevent recurrence: avoid vertical head movements. For the first 24 to 48 hours after treatment, avoid excessive vertical head movements, such as looking up to wash hair or bending down frequently. This reduces the risk of the crystals becoming dislodged again. Limit activities that require rapid head movements, like sports or certain physical activities, during this period. Avoid sleeping on the affected side. Do not sleep on the side of the affected ear for 1 to 2 days after treatment. This helps to ensure the crystals remain in place. Consider using pillows to prevent rolling onto the affected side during sleep. Sleep with head elevated. Keep your head elevated at least 30 degrees while sleeping for the next 24 to 48 hours. Using an adjustable bed or stacking pillows can achieve this. If comfortable, consider sleeping in a recliner or an adjustable chair. Long-term prevention strategies. Beyond the immediate post-treatment period, there are several long-term strategies to consider for reducing the risk of BPPV recurrence. Regular follow-ups. Schedule regular checkups with your healthcare provider, especially if you experience recurrent episodes. Early intervention can prevent the condition from worsening. Head and neck exercises. Gentle exercises and stretches for the head and neck can help maintain flexibility and balance, potentially reducing the risk of future episodes. Exercises like Tai Chi or yoga can improve overall balance and body awareness. Avoid prolonged head positions. Avoid keeping your head in one position for long periods, such as sitting at a desk or watching TV. Regularly change positions and take breaks to move around. Manage stress. Stress can exacerbate many conditions, including BPPV. Engage in stress-reducing activities such as meditation, deep breathing exercises, or hobbies you enjoy. Maintain a healthy diet. A balanced diet supports overall health, which can indirectly impact conditions like BPPV. Ensure adequate intake of vitamins and minerals, especially those that support bone and ear health. The role of vitamin D. Emerging research indicates a possible link between vitamin D deficiency and the recurrence of BPPV. Vitamin D plays a crucial role in calcium metabolism, and low levels of this vitamin might contribute to the instability of otoconia. Several studies have investigated the relationship between vitamin D levels and BPPV. Here are some key points. Vitamin D deficiency and BPPV. Individuals with recurrent BPPV often have lower levels of vitamin D. Supplementation in these cases has been shown to reduce the frequency of recurrences. Research typically involves dividing participants with BPPV into groups based on their vitamin D levels. Those with lower levels receive vitamin D supplements. Studies have generally found that vitamin D supplementation can decrease the recurrence rate of BPPV, particularly in individuals who are deficient. Vitamin D supplementation. If you have experienced recurrent BPPV and have low vitamin D levels, consult a healthcare provider. Before starting any supplementation, it is important to discuss it with your healthcare provider. They can order a blood test to determine your vitamin D levels and recommend an appropriate dosage. Vitamin D supplements are available in various forms, including tablets, capsules, and liquids. Your provider can help you choose the best option for you. Follow the prescribed dosage carefully to avoid potential side effects of excessive vitamin D intake, such as hypercalcemia. Dietary sources of vitamin D. In addition to supplements, you can increase your vitamin D levels through diet. Foods rich in vitamin D include fatty fish, like salmon and mackerel, fortified dairy products, and egg yolks. Moderate sun exposure can also help your body produce vitamin D naturally. Practical tips for managing BPPV. For individuals dealing with BPPV, practical tips and lifestyle adjustments can make a significant difference in managing and preventing episodes. Here are some additional strategies. Stay hydrated. Dehydration can exacerbate dizziness. Ensure you drink enough water throughout the day. Review your medication list with your provider if you are taking prescribed or over-the-counter medicines. Some medications can contribute to dizziness. If you suspect your medication might be causing or worsening your symptoms, discuss alternatives with your healthcare provider. Limit caffeine and alcohol. Both caffeine and alcohol can affect your inner ear function and potentially trigger vertigo. Moderation is key. Stay active. Regular physical activity can improve overall balance and coordination. Engage in low-impact exercises that do not involve sudden head movements. Educate yourself. Understanding BPPV and its triggers can empower you to take proactive steps in managing your condition. Seek reliable sources of information and consider joining support groups. Managing and preventing BPPV requires a comprehensive approach that includes immediate post-treatment care, long-term lifestyle adjustments, and possibly vitamin D supplementation. While recurrence is common, being proactive and informed can significantly reduce the likelihood of future episodes. By avoiding specific head movements, sleeping with your head elevated, and addressing potential vitamin D deficiencies, you can create a more stable environment for your inner ear. Regular follow-ups with your healthcare provider, engaging in balance exercises, and maintaining a healthy lifestyle are also crucial components of long-term management. Patient experiences and scientific research continue to shed light on effective strategies for managing BPPV. As research advances, new treatment techniques and preventive measures are likely to emerge, offering hope for those affected by this condition. Ultimately, the key to managing BPPV lies in a combination of timely intervention, preventive strategies, and ongoing support. By taking these steps, you can minimize the impact of BPPV on your life and enjoy a greater sense of stability and well-being. If you found this video helpful, don't forget to like and share it with anyone who might benefit from these BPPV prevention tips. For more valuable content and updates, subscribe to our channel and smash that notification bell so you never miss a new video. Your support helps us bring you the best information to stay healthy and vertigo-free. Also, click on the video to your right, and the one below is what YouTube thinks you should watch.